family, and welcome back to Beyond the Chart by Now Included. I'm Dr. Raquel, medical editor at Acclinate, and I am so glad you're here. Today, we are diving deep into the power of trust, the mental load of caregiving, and how we navigate the intersection of our physical, mental, and social well-being. Joining me today is Dr. Macie Smith. Dr. Macie is an award-winning educator, best-selling author, powerhouse in social work, and a champion for caregivers and seniors. She doesn't just look at the diagnosis, she looks at the life being lived around it. Dr. Macie, thank you so much for being here.
Thank you for having me, Dr. Hammond. And wow, what an introduction. I'm looking like, who's she talking about?
Yes, it's an honor. Yes, it's one thing to see someone online, but to see the lives you've touched is life-changing. So we thank you so much for your time today. So could you share a little bit about the person behind the title and what really made you want to make community so clearly the center of your practice?
Yeah, I'll tell you, I'm from a really small town in South Carolina. My grandmama lived with us, and then when she moved out, it was right in the backyard. You know, the family is right around each other. And so we really were a community. I graduated from South Carolina State University with my degree in social work. I got my master's in rehabilitation counseling. And so I started my career actually working with adults with intellectual and developmental disabilities. What we learned is that, people with intellectual disabilities are living a lot longer with modern medicine, with more support in natural environments. And so my individuals started to develop Alzheimer's or dementia, and I really did not have a sense of what that actually was outside of my mama telling me it's old timers, which is not a thing. So it's like when your mom and them tell you something that is not true, then you're like, wait a minute. That wasn't true, but that's just what they knew. And so I was responsible for hundreds of adults with intellectual disabilities, not only the adults, but also their caregivers. And so I went out and got more training. And so when I got in tune to that whole arena, that was my jam. And I have been in the industry now for over 25 years. And my job and what I feel like my purpose on this earth is not to impress people, but to impact people.
Hearing you speak is to me why you have made such an impact on the world. And you said something so powerful in that it's not to impress people. And you are impressive. You are absolutely impressive. But to me, people like you show us what purpose looks like. It just inspires me and inspires other people to say, like, what's my purpose? Like, what am I supposed to be doing? Truly an inspiration. And just thank you so much for sharing a little bit about your background. And that's exactly why your perspective is so vital to us today. You touched on the fact that care doesn't stop. When a person walks out of their doctor's room, that care doesn't stop for them. It actually begins in the places where people actually live, like you were saying, in your community, with your family, like those things matter. And so before we get into our first case, I do want to pause for a second and define a term that is essentially the clinical language for what we do every day. And it's something called SDOH, social determinants of health. If you don't know, your social determinants of health are the non-medical factors that influence your health outcomes. Experts usually group these into 5 key domains. So first is your economic stability. This is your job, your income, and whether your housing is stable. This matters for those communities. And if we aren't touching on that, we're missing a very vital piece. Also, education access. So that's literacy and the quality of schooling that's available to you. Your healthcare access. That's your proximity to providers and the quality of insurance. Number 4 is your neighborhood and built environment. This is going to be clean air, safe housing, and access to healthy foods. And finally is social and community context. That's exactly what Dr. Macie touched on. This is your support systems and your experiences with your community, and unfortunately, some of your experiences with discrimination. Research shows that clinical care, so the stuff that happens inside the clinic, only accounts for about 20% of health outcomes. The other 80% is driven by these social factors and our behaviors. When our community understands this, we stop asking, why is this person sick or why is this person suffering? And we start asking, what is in this person's environment that is making it hard for them to stay well? So, with this 360-degree view in mind, let's take a look at our first case. So, Dr. Macie, I'd like to introduce you to Mrs. H. So, Mrs. H has lived in the third floor of her walk up for 40 years. She has just been diagnosed with stage 3 cancer. The grueling schedule of chemotherapy and radiation has left her physically depleted, making the stairs a mountainous barrier. Her neighborhood is gentrifying. I'm in Atlanta, so I see that all the time. While there are new coffee shops, the legacy pharmacy has closed. Her daughter is overwhelmed, not just by the logistics of transportation, but by Mrs. H's declining mental state. Mrs. H is becoming withdrawn, refusing to eat, and losing hope because she feels trapped in her own home. So, Dr. Smith, we see how the physical environment dictates the mental state. When a cancer patient like Mrs. H is stuck on the third floor, her world really shrinks to these four walls. So, how do you, as a social worker, assess the mental health of a home and help a person find the will to keep fighting when their environment feels like a cage?
I like to look at things that you can change. There are certain things you can't change. So if there are things that I can't change as a social worker or the family can't change, then those are the things that we're not going to bring up. That's almost telling people to eat healthy, but they don't have no place to live. I would go in and assess, number one, what medical condition are we dealing with? What type of cancer is it? What stage is it? Is it treatable? Can it go into remission? Because what that does is it helps me to develop talking points or a carrot to be able to position hope. You want to be very careful in what you say, because when someone is grieving, one of the things you don't want to say is everything's going to be all right. You got to know what to share with them and what conversations to have in order to create a hope caveat there. Then I'm going to assess the natural supports. So the natural supports based on what you're sharing is one daughter. You have to really be able to position yourself and have a conversation with your children about what care for you is going to look like. So I see that there's one child that's the caregiver trying to hold it together. So the capacity could be limited there because I want to make sure that this caregiver is healthy as well in order to be able to provide care for the person. The next thing I'm going to look at is their living environment. If her climbing those stairs are going to be more harm than help, then we probably going to need to look for a different space with her involved. If they're not a part of the conversation, it's your plan, not theirs, and it's not going to be successful. And the community you're saying is already being gentrified, so the familiarity and the comfort is no longer there. So we may be able to find community that may be closer to the daughter, that may be some people who may be going through or have gone through what Mrs. H is going through that can actually offer peer support for her. Every situation is different, but I always like to start with hope, and I always like to start with things that we can change. It's very important to ask people what they want. What's important to them? What do they like? What do they love? Because that's going to help me develop that plan of care around their well-being and what's important to them.
The way that you described that care comprehensively is something I've never heard before. And I think that's what gets missed all the time. Like you're talking about, let's get to the root. Like we can't like go against this person, what they're suffering but what you're saying is, number one, like, do we even understand what's really happening? And I feel like sometimes people look at this diagnosis alone, but they aren't thinking about it comprehensively like you are. And I think that's why so much care is fragmented.
It is. And I'll tell you, the medical model is a standalone model. The social model more so is more, in tune and tries to work with synergy with the medical model. But sometimes, and I ain't talking about you, Dr. Hammonds, because I know you ain't like that. They don't like to work with social workers. They like, wow. You don't have you're not a medical doctor. No, but guess what? I see what you don't see behind these four walls in their community, in their home, when they got adult children who are causing them stress more than support. Slowly but surely, we are seeing where medical doctors and physicians are finding the value in social workers and bringing them on as a part of the team.
I have so many thoughts and feelings about what you said about, I see the things you don't see in the four walls, but they also tell you things that they aren't going to tell their doctor because they feel seen.
And I'll tell you too, there still is a white coat syndrome out there. The doctor knows everything. Don't interrupt the doctor. Don't ask the doctor questions. And I even told my mom once, that was a couple of years ago, she needed to go to the doctor to get some stuff checked out. And I was like, look, either you gonna tell the doctor this, or I'm taking you to your doctor's appointment. She was like, no, you not. Like, she was like, no, you not, because you like to run your mouth too much. Like, I'm an advocate to the T, honey, like to the bone. I don't play about vulnerable population. I don't play about seniors. You know you and your loved one way better than any doctor does. The doctor needs the information. They don't need you to diagnose them. They need the information so that way they can make a reasonable determination of what's happening. In addition to, we talk about, cultural aspects. We know based on the data, and I know you know this too, that when physicians look like their patients and they have the experience of their patient and they can talk like their patients, there are better health outcomes, as opposed to this doctor that don't look like me, don't talk like me. There's no need for me to even say anything because he ain't gonna understand what I'm saying. And that's when the care, the care is harmed at that point.
I see it a lot in my family. So my mom is older. My grandma had dementia. Her mom had dementia. And I always noticed, like, even when my aunts got dementia, there were these red flags that I feel like were sometimes missed. I was watching one of your interviews and you talked about people say dementia as if it is like all encompassing, but you talked about it in relation to like a cough and how sometimes people don't think about, like you're describing like a symptom of something. When you said that, it clicked in my head. Oh, these were the things that I think I might have been missing in my own family that I know other people probably have questions about too. And so when someone has a family member that may be developing dementia, or in this case with someone that has cancer and they may be starting to have some type of mental health symptoms that could be like depression or anxiety or any of that, are there any red flags that you look for that families could use?
My grandmama used to love to go fishing. So when they had no desire to go fishing anymore, like no get up and go, no motivation, no initiation, we knew that something was wrong. So my grandmama dealt with depression and also a progressive type of dementia. She stopped wanting to do the things she wanted to do. So if their hygiene is starting to look different, if they're no longer communicative like they used to, if they're having trouble following conversation, that could be a problem. If they're starting to isolate themselves and not wanting to have visitors come over and they're not wanting to go out, that is a problem. There still is a stigma, especially in the Black community, around mental health. I'll tell you, my mom has anxiety, but she don't call it anxiety. You know what she calls it? I got nerves. When we start talking about behavioral health, which is overall health, in a natural way, in a natural environment, just like we talk about if we got a headache or if we got a pain in our leg, if our chest hurting, when we talk about anxiety and depression in that same vein, you'll have more buy-in from the baby boomers and the traditionalists. So now my mom says, I have anxiety. I said, you better go ahead, mama. And when she says it, guess what my aunt says? Well, I might have it too. Now, what you taking? Well, I'm gonna ask my doctor. So I'm like, yes, that's what I'm talking about. That's how you build community. We want to be sure that our loved ones are engaged in community, going out. We're social beings, and so we value socialization is very important because social isolation is a medical condition that can kill you. And we're talking about upwards of almost 1 million people a year actually die from social isolation. That was music to my ears, Dr. Hammonds, because I like to talk anyway. So, all those, marks on my report card that said Macie talks. Look, I'm trying not to die early.
You really touch on the care of our seniors who have cancer or mental health or Alzheimer's or are even like starting to display, like you talk about their well-being in a way that is not done enough. I see why now you have really etched your own lane because you're not talking about it from a textbook perspective. You're talking about this like, no, this is real. Like I have not only seen this in patients, but I see this in my life. Whenever, like, especially working here at Acclinate and seeing people that have these conditions, like it's one thing to be in medical school and learn about something. And you're like, oh, okay, well, Black women have this condition at a higher rate. And then when you meet that person and you see their quality of life and it's like, Oh, now I understand. Like now I really have to like take care of this person, take care of this population of people. And that's what you do. And that's why it was amazing hearing you speak about Mrs. H and people like her. And you really gave her family like tangible things
Yeah.
that they can take with them. So I'm going to pause for a second. We're going to take a quick break and we'll come back and talk about the sandwich generation.
Get trusted resources backed by medical pros for your health. Tap into real experiences from people who look like you and find a safe place for your story. Walk into a space where being you is celebrated and find your power. Your health, your story, your power.
So Dr. Macie, a 45-year-old woman is caring for her mother, who is showing early signs of Alzheimer's while also raising two teenagers. She is overwhelmed, noticing her mother is becoming increasingly agitated in the evenings, known as sundowning, and she doesn't know how to balance safety with her mother's desire for independence. So, as a social worker, how do you help families navigate the guilt associated with setting boundaries or seeking outside help?
What tends to happen when people get a diagnosis of dementia, the caregiver reacts more so than the person who has dementia, right? You don't want to restrict them immediately because you're focusing on the disease and not the person. Because a person has dementia and they're showing early signs, they still can live independent. They just may need reminders. So you don't want to go to the more strict strategies or ways of actually caring for them, because what's going to happen is it's going to cause more problems than not, because they're going to get aggressive. Even though you ain't never heard your mama cuss a day in her life, she might cuss a little bit, right? Because now what you're doing is you're trying to parent your parent. They don't need a parent, they need a partner, right? So they need your help and support through the journey. And so, which is why it's very important that they have resources. Like the resources that now included talks about early stages and what early stages look like and what are some of the supports they need. They're going to need different levels of support at different levels of the disease process. So once you're seeing early signs, the very first thing I would suggest the family member do is speak with other family members and those close to the person to see if what you're seeing is what they're seeing. You want to compare notes, and then you want to talk to the person, right? Don't go in and say, Mom, I think you got dementia, you ain't remembering nothing, this, that, and other, because the last thing anybody wants to lose is their mind. So don't lead with that. You talk about what they're experiencing. Are you remembering things the way you used to? Because someone who has a progressive type of dementia, they have known it way before anybody else does. They have displayed and experienced symptoms 15 to 20 years before anybody else notices it or before diagnosis. And so you have to be the one to have that conversation, because based on the response that we get from the physician after they've done what we call differential diagnosing, making a determination that these areas are treatable, now we move to the next step. I don't ever go in and say, hey, she's showing early signs of dementia. Okay, you need to move the stove out of the house. You need to rearrange her room. You need to make sure that there's a sitter, because grown people don't have sitters. Babies have sitters, right? I'm not gonna say that, and somebody needs to be there 24/7 watching them. No. Better understanding the disease process, if it actually is the disease, will set the stage of what that course of action will look like and what that plan of care would look like.
Mic drop. Like that is it. Like that's exactly it. And you are really touching on language. Like you're saying, like you have to consider this is a person who is also going through something that is terrifying. And when you are making decisions, making sure that you're also using language that makes them feel safe. And so I love how you're touching on language. And if someone, let's just say like their family is experiencing these changes, is there anything they should do immediately to like dementia proof the home environment without making it feel like a clinical facility?
Dementia proof is very similar to child proof. I'm going to tell you the difference between the two because they're different. So a child is learning and growing and building. They don't have experience in the kitchen cooking. They don't have experience in the laundry room doing laundry. And so when you restrict them from these areas, they're to assume it's for, for the best for them, so that way they won't get hurt. Someone that develops a progressive type of dementia, they've been there and done that, and they're losing capacity. So when you try to dementia proof a home, you're taking away their independence. So you don't want to go in and immediately restrict things. And I don't want you to wait until something happens, but there is areas of gray there. But if you see your loved one come out of the house with a red shoe on and a brown shoe on, they look down and think it's okay, then that tells you right then that the decision making may be a little off. So now I may need to unplug the stove, but leave it there. It has to look the same, but it's safe, if that makes sense. They don't have to see the safety measures that you're putting in place. But we got a bad habit of what I call pulling rank, right? And then when they get a little aggressive to let you know what they ain't gonna do and what you're not gonna do, then you say, oh, I need some medication because mama is aggressive. No, when families come to me and talk about the behaviors of their loved one, we all have behaviors. It's our response to the world around us. I usually look at the caregiver and I say, now tell me, how did you communicate that? Well, I just went and told her this and I just went and told her that. Was that how you would talk to your mama before dementia? Well, you don't need to talk to your mama like that after dementia, because guess what? She's your mama with dementia. Mama first, the person first perspective.
Like, hearing you talk is also convicting me because I am very overprotective of my mom. It's so crazy how it's flipped now. And sometimes I'll be like, and it's just like, and then it's like, okay, well, now I'm not going to tell you nothing. Like, now I'm really about to, shut you out. Like, I really hope that if you're watching this and you're a caregiver, I really hope that you pay close attention to what Dr. Smith is saying. You have to remember that they are human beings also having a lived experience. They are also navigating this for the first time. And so, yes, we care and we want to make sure we're doing all the right things, but you cannot take away their independence. You cannot make them feel like they don't have freedom to exist.
We want to feel value at our work. We want to feel value and wanted and needed at home. We don't feel it here. That's what's deteriorating. We feel it here, and this is beaten strong. So as long as they have blood running through their veins, they are still the same person. They're just responding to their environment with limited or with changing cognitive capacity.
This is so good. This is so good. And I do not hear enough of these conversations. Like, I don't hear enough people talking about it. I know I said it, but the way that you advocate for the human behind the diagnosis or whatever, that. That is something I don't hear enough. It's like, oh, this person has this thing and this is how you treat it. Like, you flipped it.
Like I said, I ain't here to impress a lot of people, but I am here to impact some people. And that is to build quality of living, not necessarily quality of life, because that's existing. I want to build quality of living for not only the person living with the chronic illness, but their family caregivers as well.
And I know, especially the caregivers who are in this sandwich generation and don't really know about FMLA or any other resources, are there any FMLA or caregiver support programs that you wish more caregivers knew about?
So with FMLA, and I know we've been fighting here in South Carolina for paid FMLA, because right now you can take FMLA for family members, just say if you're a family caregiver. However, it's not paid. You either have to use your annual leave or your personal leave or your sick leave. When that runs out, you're still protected, but you're not getting paid. So you want to, ask your employer about, okay, I can get or qualify for FMLA for so many weeks or months, but is it paid? The other resource that I think is underutilized is the EAPs, Employee Assistance Programs. And when I tell you the support that they provide, I never even knew about it. And I'm training them. They have counseling support services. They connect you with adult day services to help with caregiving, because that's the resource that I provide for the EAP. So they have a list of resources that they can provide to the employee. But here's the thing. The only way you're going to access that resource is if you ask for resources. A lot of times our sandwich generation caregivers, because it's an isolating role and they feel like they're in it alone, they don't say anything because of the threat of losing their job, the threat of being labeled, the threat of being demoted and no longer promoted. It's almost like it's an invisible disability, but it's not, because I guarantee you, once you go to your supervisor or your lead or your HR person, somebody in that office is experiencing it too or has experienced it. And I always say we're all an accident, an injury, or an illness away from either being a caregiver or needing a caregiver. So when I say you're not alone, I tell people all the time, you know, y'all know the numbers, but I know the names. And when I say it, I mean it, and it's factual.
This is so valuable. Like, this is why they pay you the big bucks, because you are the real deal. And I feel so,
I didn't hear that part.
this is why they pay you the big bucks, okay? Because you are the real, you are the real deal. And I feel so grateful for the families and the caregivers and even the people who will access these resources and now be able to make a better decision. So thank you so much. We're going to pause one last time and come back with our final case.
Get trusted resources backed by medical pros for your health. Tap into real experiences from people who look like you and find a safe place for your story. Walk into a space where being you is celebrated and find your power. Your health, your story, your power.
We have touched on some truly beautiful cases and experiences today, and we're going to finish off with a case about the economic cliff and nutritional security. So a family in a working class neighborhood is caring for a father with early onset dementia. They fall into the missing middle, making just enough to be ineligible for state subsidies like Medicaid or SNAP, but not enough to afford private in-home care. Because they live in a food desert, they rely on processed convenience store foods, which are worsening the father's health conditions as he lives with high blood pressure and diabetes. So Dr. Macie, health experts always recommend the Mediterranean diet for brain health. What is your practical advice for a family living in a food desert where the only fresh food comes from a Dollar General or a gas station?
So one of the resources that I would give is the Department on Aging. Every county has a local Department on Aging. It's usually nestled within the county. Not only for individuals who are aging, but they may also have resources to connect if it's somebody who has a disability as well. So the Department on Aging actually has vouchers to help family members actually pay for someone to come in to help them take a break. They also connect with Meals on Wheels. The Meals on Wheels, they not like the school lunches. You remember the summer lunches? And during the summer, I used to love to go get the little juice boxes. I didn't care nothing about the food and had a little sandwich with the hamburger buns. It's not that. It is a much different quality now. Also, they have senior resources, connections. They have connections with transportation. And so your first stop would be connecting with your Department on Aging, which is in every state, and is a subsidy of that in every county. Also, too, Medicare now has a program for those living with dementia. It's called the Medicare GUIDE Program, GUIDE. Traditional Medicare and third-party insurance does not pay for non-medical care, which is someone to come into the home to help with bathing and dressing, cooking, cleaning, and all that stuff. That comes out of pocket. But as you stated, you don't have enough to pay out of pocket. Medicaid will cover it. So get with the primary care physician and or the neurologist to see if there are a guide provider. So that way they can connect you to the program to get the financial resources for an in-home caregiver. It'll connect you with a geriatric care manager like myself to help you navigate the long-term care system and connect with resources. It also provides families with training. Not just anybody can care for someone with Alzheimer's disease or a progressive type of dementia, especially with early onset. And you'll need to be connected to a therapist because it is a grieving process. You're probably going to go through what we call anticipatory grief, actually grieving the person that's still living right in front of you because their cognitive stance is changing right in front of you. And then you want to be sure that you are connected. If you are in this gap generation, with the elder attorney. So a certified elder attorney actually helps me with my clients do what we call Medicaid planning. Unfortunately, but realistically in America, you have to go broke in order to be able to afford long-term services and supports. And so that certified elder attorney will help individuals preserve their assets and diversify their assets. So that way, Medicaid still does a 5-year look back, but you can go ahead and start the process now. So that way, 5 years later, you will be well positioned to apply for Medicaid and get approved for Medicaid. And Dr. Hammonds, I'll tell you, my book, The Complete Dementia Caregiver's Guide, I break it all the way down from A to Z if you're caring for someone living with dementia, because it is an ever-changing journey when you're caring for someone living with dementia.
I was working with, I can't remember the name right off the top of my head, but I remember trying to find resources on caregiving. And there are, I think like ASCO, there's different like organizations that will have some resources, but like you're saying, like you have created this access in a way that everything you need is in this book. Like you can read this. Yeah.
And I'll tell you, too much information is just as bad as not enough information. Like I'm going to compile the information for you and I'm going to put it in a digestible format so that way you can get exactly what you need. It gives you enough information to be active, to be informed, so that way you can plan for the journey ahead.
As we really wrap up and we talk about like planning for this next journey, because this family is very similar to other people where the person who they are caring for also has like these comorbidities. And so we know that uncontrolled diabetes and high blood pressure increase the risk of Alzheimer's. But how do we help a caregiver prioritize health when cheap food is the only food they can afford and the father's cognitive state makes him resistant to dietary changes?
It depends on where they are in the disease process. It depends on if it's a progressive type of dementia or if it's a treatable type of dementia. Now, if someone is in the early stages of Alzheimer's disease, and this is a blessing, we have a treatment now. There are 2 treatments that will treat the disease in the early stages. It won't cure it, but it will slow it down significantly, affording the person a longer quality of living. But if they've gotten the treatment, they're doing well, then that's where that part ends in addition to connecting with these other resources. And, it's not a magic pill. There's not one answer, but you have to connect with resources that's going to connect you with other resources to get you what you need. But what happens, Dr. Ham, is I'm going to say 2 things. One thing is, depending on the community that you're in, sometimes we don't get the information. In addition to food deserts and hospital deserts, we still have broadband deserts. So how are people getting the information? Are they getting the information? Are you still sending it snail mail, or are you plastering it over social media and the internet when these people is spotty and they really can't get to it? Or is the information being relayed in a way that's not understandable? And is it intentional? I'm thankful to you. I'm thankful to Now Included and Acclinate for building this platform for people like us to be able to get information to help support not only their families, but to help support themselves, because every day, every moment, every minute, we are aging. So we got to be prepared.
Yes. I have a whole ending, but I'm not even going to say it. Dr. Macie just mic dropped again, ended the whole episode. I mean, literally, Dr. Macie, I feel so honored that I got to sit here with you and talk to you and learn from you. You told me so many things I have never heard. I need to go back and play it back for my own family. I want to make sure the people closest to me hear it, my colleagues hear it. Like, you have a real gift, and I feel so grateful. Thank you so much, Dr. Macie, for being here. Thank you so much to the Now Included community. If any of these stories sound like your life, We urge you to join the Now Included community. We are building a space where you are heard and supported. Subscribe, and let's write the rules of caregiving together.